Assalamualaikum warahmatullahi wabarakatuh and hi. My name is Siti Khadijah binti Azmi and I will explain about the introduction for this video. So, as the title states here, our team will explain about motor neuron disease and motor dahari. So, what is relationship between motor dahari and motor neuron disease? So, before we start, let me tell you who is motor dahari. Okay, now let's get to know about Datuk Mokhtar bin Dahari. Datuk Muhammad Mokhtar bin Dahari was a Malaysian football player from Setapak, Selangor. He played for FA Selangor for most of his life. He is considered as a legendary footballer in Malaysian football history, especially with FA Selangor. A prolific forward, he was nicknamed Super Moh due to his playing skills and strengths. He scored 89 goals in 142 international matches for Malaysia and helped the team reach its higher ELO ranking in 1977. Mokhtar is the all-time top scorer for the Malaysian national team. The evidence is on 29 June 2021, FIFA acknowledged him as the third top scorer at the international level with a total of 89 goals behind only to Ali Day and Cristiano Ronaldo. Okay, now let's continue to what is relationship between motor dahari and motor neuron disease. So, from my research from the website, I found that Mokhtar began having throat problems and went to the hospital to find out what is the problem. So, after that, doctor diagnosed him as having motor neuron disease, which is MND, with the discovery only being told to him and his wife. Then, he went to London with his wife in attempt to cure his condition, but his condition become worsening after 3 years battling with the disease. Mokhtar died at the Subang Jaya Medical Center on 11 July 1991. But the press reported Mokhtar suffering from muscular dystrophy as the cause of his death. His body was laid to rest at Taman Keramat Permai Muslim Cemetery in Taman Keramat Ampang, Selangor. His life journey and the real cause of his death was only revealed for the first time in a documentary called The Untold Truth about Super Moh in the National Geographic Channel on 30 August 2010, about 18 years after his death. Okay, that's all from me. So I will pass to my friend to explain more about motor neuron disease.
Assalamualaikum warahmatullahi wabarakatuh. My name is Siti Khadijah binti Azmi and today I want to explain about what is motor neuron disease and the cause of the disease. What is motor neuron disease? Motor neuron disease is a rare condition that affects brain and nerves. This is because the motor nerves that send electrical signal to the muscle of the body is failed to function. There is still no cure for MND, but there are treatment help to reduce the effect to the patient daily life. The disease is a neurodegenerative disease, and the disease can appear at any age, but most patients are over 40 years old. MND also affects men more than women. The real cause of the disease is still unknown, but from the several studies, the possibility of the disease is caused by various factors like genetic, virus, toxin, and environment. There is a type of MND that inherited due to gene abnormalities. However, other type of the disease occur randomly. About 5 to 10% of MND cases are due to genetic factors. The majority of cases found that 90 to 95% are sporadic. Most cases are sporadic and the cause is believed to be due to environment, toxic, virus, or genetic factor that may be involved.
Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Wazinabil bin Rosli. So today I will explain about process of motor neuron disease. So what is the motor neuron disease? So motor neuron disease (MND) is a rare neurological disorder that affects the brains and nerves. It causes weakness, which worsen over time, and when there is no cure, but there are treatments that can help reduce the impact it has on person's daily life. Some people have the condition for a long time. Many also can significantly reduce life expectancy and sadly eventually result in death. So next, we must know about the symptom of motor neuron disease. So motor neuron disease symptoms appear gradually and may not be obvious at first. As we know, early symptoms can include light weakness to body may have a hard time to move your body. So second is slurred speech, which is may lead to difficulty swallowing certain foods. So third is a weak grip. You may drop items, have difficulty opening jars or putting buttons on. The last is the weight loss. Is you can see your body will have a thin body over time. Is who gets a motor neuron disease and why? Motor neuron disease is a rare condition that primarily affects people in their 16 and 70. Though it can affect adults of any age. It is caused by a problem with cells in the brain and nerve called motor neurons. These cells gradually cease to function over time. It is unknown why this occurs. Having a close relative with motor neuron disease or a related condition known as a frontotemporal dementia can sometimes increase your chances of getting it. However, in most cases, it does not run in families. So first thing first, you must see a general practitioner. If you have possible early symptoms of motor neuron disease, such as muscle weakness, you should see a doctor. Although you are likely to have motor neuron disease, getting a correct diagnosis as soon as possible can help you get the care and support you require. If a close relative has a motor neuron disease or frontotemporal dementia and you are concerned that you may be at risk, you should see a doctor. Your doctor may refer you for genetic counseling to discuss your risk and the tests available to you. So next, we will do a test and diagnosis. Motor neuron disease can be difficult to diagnose in its early stage. There is no single test for it, and several conditions cause symptoms that are similar. A neurologist may order the following tests to rule out other conditions. First is a blood test. Second is a scan of your brain and spine. Third is test to measure the electrical activity in your muscle and nerve. Fourth is a lumbar puncture, which is when a thin needle is used to extract and test fluid from your spine. So lastly, how it progresses. Motor neuron disease worsen gradually over time. Moving around, swallowing, breathing become increasingly difficult. The necessitating treatments such as a feeding tube or breathing air through a face mask, the condition eventually leads to death. But the time it takes to get there varies greatly. Motor neuron disease affects a small number of people who live for many years, if not decades. You may prefer to not to know how long you have left. If you want to learn more, talk to your doctor or a member of your care team. So that's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Ungkono Sharafina binti Ungkono Rahmai and I will proceed to the types of motor neuron disease. So we have 5 here, and first is ALS, which is the common type of MD, and it affects upper and lower motor neuron. Next we have primary lateral sclerosis, and it affects the neuron in the brain, and it is the rare form of MND and that advance more slowly than ALS. Next, we have progressive bulbar palsy, which is BBP. It involves the brainstem, and people with ALS often have this. And PBB will cause frequent choking spells and difficulty speaking, eating, and swallowing. Next, we have progressive muscular atrophy, and this is the most rare MND type, and it affects the lower motor neuron in the spinal cord and cause slow but progressive muscle wasting, especially in the arms, legs, and mouth. And last, we have spinal muscular atrophy, which is SMA, and SMA inherited MND develops in children, and there are three types, all caused by a genetic change known as SMA1, and it tends to affect the trunk, legs, and arm. Next is the symptom of motor neuron disease. So the different type of MND cause similar symptoms and have three stages, which is early, middle, and advanced. So the disease progress at different speed and vary in severity. So here is the early stage signs and symptoms. So it is typically symptoms that begin in the arms and leg, and also in the mouth and respiratory system. So it can include with a weakening grip, which makes it hard to pick up and hold things, fatigue, muscle pain, cramps and twitches, slurred speech, weakness in the arms and legs, clumsiness and stumbling, difficulty swallowing, trouble breathing and shortness of breath, inappropriate emotional response such as laughing or crying, weight loss as muscle lose their mass. Next is the middle stage signs and the symptoms. Okay, so the early symptoms become more severe, and which is they will experience muscle shrinkage, difficulty moving, joint pain, drooling due to problem with swallowing, uncontrollable yawning which can lead to jaw pain, change in personality and emotional states, and lastly, difficulty breathing. So people with ALS experience brain involvement including memory and language problems. It also reports that around 12 to 15% of people with ALS develop dementia. Some people also experience insomnia, anxiety, and depression. Finally, we are at advanced stage signs and symptoms. So eventually, a person with advanced ALS or MND needs help moving, eating, breathing, or a combination of this. And the disease can become life-threatening, which can cause breathing problems. And the most common is it can cause death. So that is all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Ishraf Imran bin Mazlan, and right now I will present to you about the motor neuron disease, the effect of the MND to the body. So first of all, the motor neuron disease will weakening the muscle. So from the picture here, we can see that there is a difference between these two axon. First, from here, we can see that this axon is bigger, so the muscle also bigger. But on the right side, the axon is like about to die or very shrink, and the muscle also follow the axon. So from this effect, our body can will be difficult to speaking and to swallow the food, and also at the night, our body will have some problem, which is sleeping problem or insomnia. Next is treatment for motor neuron disease. Based on my research on Google, unfortunately, there is no cure for this disease, but there is one medication that can prevent or make the patient live longer, which is riluzole. Or from this picture, we can see that this is the medicine that I mentioned before. The function of the riluzole is to slow down the progressive damage to the motor neuron cell. So by reducing their sensitivity to the nerve transmitter glutamate. So if our parent or our friend have this disease, we can show them this medicine to prevent them from this disease. Next is, okay, this is the resource that I used for this slide. And I think that's all for me. Thank you. Right now, I will pass to my friend to continue.
Who has a higher risk of motor neuron disease (MND)? Although motor neuron disease (MND) is extremely rare, the illness can afflict adults of all ages, including teenagers. It is more common in men than in women. Next, there are approximately 5,000 people in the United Kingdom who suffers from the illness at any given moment. Every year, roughly 2 people in every 100,000 in the UK are diagnosed with MND. It's pretty low amount, but still it affects a lot of like 5,000 people a year. That's at that given moment, not a year. Sorry. So yeah, it's pretty a lot, even though it's in numbers it's pretty small. But yeah, it's commonly diagnosed in persons over 50, but the majority of those who have it first detect symptoms in their 60s. So it's mostly just older people or elderly people that affected. And so next, according to the National Institute of Neurological Disorders and Stroke (NINDS), about 10% of amyotrophic lateral sclerosis, which is ALS, in short cases in the United States, are inherited, or the inherited from the genes, like from the parents and yeah, great parents, all that. So it is most common between the ages of 55 and 75. Again, it's from affected for most elder people, but it also affect adults of all ages or teenagers. But yeah, mostly elderly people. Next, according to a 2012 study, football players have a higher risk of dying from ALS, Alzheimer's disease, and other neurological disorders than non-footballers. Experts believe that there may be a link between this and recurring head injuries. Next, one of, like more famous people like Steven Hillenburg was an American animator, writer, and producer. He is the top. He's the creator of SpongeBob SquarePants, a successful Nickelodeon animated television series. Hillenburg revealed in March 2017 that he had been diagnosed with ALS. He then passed away on November 26, 2018 at the age of 57 at his home. Another example would be Stephen Hawking, a well-known English theoretical physicist and cosmologist. Hawking was diagnosed with ALS, a slow progressing early onset form of MMD, in 1963. He later then sadly passed away peacefully at his home in Cambridge on March 14, 2018 after a long battle with ALS. Lastly, the conclusion. Even after 3 years of battling progressive muscular atrophy (PMA), a difficult motor neuron disease (MND), Dato Mohta Dahari died on July 11, 1991, at the age of 37, at the Subang Jaya Medical Center (SJMC) for short. There are also various kinds of MND, such as ALS again and PMA, which is we just mentioned before earlier on. In the early stages of motor neuron disease, symptoms appear slowly. The symptoms usually start in one or two places: the arms, legs, mouth, or respiratory system. After all, breathing problems are the most prevalent cause of mortality due to this disease. Therefore, it all starts with a throat problem for Mohtad Dahri. Although some MND are inherited, the true causes of the majority MND is yet unknown. progressive muscular atrophy (PMA) is a sporadic or hereditary disease, which means it's genetic. Experts estimate that just 10% of MND is genetic, with the remaining 90% occurring at random. The majority of persons who can contract this disease are men rather than women, again. And the most devastating aspect of this MND sickness is that it has no cure, and at least not yet, quite yet. Some treatment try to halt the progression of the disease, while others aim to address specific symptoms associated with the disease and enhance the quality of life. Fortunately, it is not a contagious disease and occurs infrequently, but we should not take it lightly because it may affect anyone and has late signs, so we may not detect it if it has already affected our bodies. The causes of MND are numerous and complex, which is compounded further by the fact that we don't know what causes the death of motor neurons when someone has it. So we don't actually know what causes the death of motor neurons in the body. If we can figure this out, we might be able to develop more effective and possibly even curative treatments for the condition. So that'll be it for my presentation.